Hi there, so this is going to be my extended SBAR video submission. And pneumonia, what is it? It's a infection of the lungs, and in this case it's going to be a community-acquired bacterial infection. When that bacteria enters your lungs, it's going to cause the alveoli to become inflamed. They're going to fill up with fluid, they're going to fill up with pus, thus causing the patient to feel like they might be breathing underwater. So the patient that I chose is Irma Willis. She's a 65-year-old female that was admitted to the med-surg unit with chief complaint of shortness of breath and chest pain, accompanied by a 3-day productive cough. Her background and past medical history reveals hypertension that is controlled with oral medications. She also has stage 4 lung cancer. She was previously having her adenocarcinoma treated with chemo and radiation, but unfortunately she can't afford it any longer, and she refuses that treatment. She lives with her sister, who is also a widow. Irma Willis, she has a chest x-ray and it confirms pneumonia. So from there, I would perform my head-to-toe assessment, and in that assessment I would focus on airway, breathing, circulation, and also her neurostatus. So our patient is alert and oriented ×4. She has a temperature of 99.5, and that's going to be important to note. She has a respiration rate of 20, blood pressure 138/74. Her O2 saturation is 94%, and she's using 2 liters per minute of oxygen via nasal cannula. Her cardiac assessment reveals regular rate, rhythm, no murmurs, we're good to go. However, this is going to be a respiratory case, and we're going to make sure that we accurately and timely document our breath sounds and use of accessory muscles to breathe. So, Mrs. Willis's lung sounds, they're diminished bilaterally, and also she is wheezing bilaterally. I'm going to want to document the characteristic of her cough and sputum. She has a productive cough with thick, foul-smelling, green-yellow sputum. So after my assessment, I am going to recommend that we receive a sputum culture and send that to the lab. That way we know exactly what type of bacteria we're working with and if we have to establish any isolation precautions. Also, we're going to want a CBC with differential. That way we know how far along the infection is, if there's any anemias, or and I would recommend antibiotic and antipyretic medication and possibly an antitussive in case Mrs. Willis's coughing becomes so bad or so severe that it causes her more pain. So Mrs. Irma Willis is suffering from ineffective airway clearance related to increased sputum production as evidenced by abnormal breath sounds. My priority as a nurse is going to be to help Mrs. Willis maintain, or if possible, improve her respiratory function. The main therapeutic interventions that our nursing team is going to use with Mrs. Willis is we want to keep her in a comfortable position. That's going to be the semi-Fowler's position, keeping the head of her bed elevated in order to promote chest expansion. Also, we are going to teach her and assist her in using the tripod positioning, splinted coughing, and deep breathing exercises. And also, we would like to facilitate expectoration of the secretions by maintaining adequate hydration and utilizing nebulation treatments. Both of those are going to thin and help mobilize the secretions and hopefully get her feeling better. And once the treatment has ran its course and we feel like she's on her way, we are going to support the recuperative process, not only physically but emotionally as well. So if we need to call her sister in and get her moving, let's do that. We can call social workers to help identify what other resources Mrs. Willis is going to need. And then also if she needs to have that uncomfortable conversation about hospice care, we can do that as well. So that is my SBAR for Irma Willis. Thank you.